This is a plain CT scan brain of a 3 months old male baby who presented with seizures. Now please observe that both cerebellar hemispheres are relatively smaller in size. This is the fourth ventricle, which is narrowed. Most of the posterior cranial fossa is occupied by CSF. There is no enlargement of posterior cranial fossa. There is aqueductal stenosis. This is the region of the aqueduct here. There is moderate dilatation of both the lateral ventricles. Extracerebral CSF spaces are also mildly dilated. Now please observe the typical features of the agenesis of corpus callosum that we come across on the axial scans. There is separation of the frontal horns of both lateral ventricles. Third ventricle is slightly dilated and rises high up in between the dilated lateral ventricles. Nodular calcifications are present in both the cerebral hemispheres. These may represent either the residual effects of previous torch infection or the dystrophic calcifications. There is pachygyria. Gyri are thickened. Nodular shadows are present in the white matter and in subependymal regions as well, like this one here, this one here, this one here. These represent gray matter, heterotopia. There is overriding of the corneal and lambdoid sutures. This is the corneal scan. This is the high rising third ventricle in between the dilated lateral ventricles. Nodular calcification is both the cerebral hemispheres in pachygyria. Agenesis of corpus callosum. Aqueduct stenosis. Small sized fourth ventricle. There is no enlargement of the posterior cranial fossa. This is 3D. Please observe overriding of the corneal and lambdoid sutures.